Good news for parents worried about food allergies. Yesterday on CBS Mornings Plus, you heard part of my 2019 interview with Dr. Anthony Fauci, longtime head of the National Institute of Allergy and Infectious Diseases. In that interview, he admitted that previous guidelines for kids to avoid peanuts had actually contributed to an explosion in peanut allergies. And a new study backs that up. Researchers say 60,000 children have actually avoided developing a peanut allergy since the advice was reversed back in 2015. The government now recommends that babies as young as 4 months old be exposed to peanuts. CBS News Chief Medical Correspondent Dr. Jon LaPook is here with more. John, this initial recommendation was not Dr. Fauci. It was the American Academy of Pediatrics in the year 2000. Right. They were going off of intuition. I covered this back in 2019, not science. Now we have the science.
Yeah. And, you know, you've heard me say before, medicine is an eternally humbling profession, right? And the idea is that when the data changes, when the studies change, you don't just double down, you change the recommendation. That's not lying for the original recommendation. It's saying that was your best advice based on the limited evidence at the time, and now we're going to change it. Back then, they said, you know what, if it's causing these terrible allergies, let's avoid it. It turns out that that was wrong, that in fact,
So how does the early exposure work then?
Well, the thinking is, you know, if you give it earlier, it actually teaches your immune system that it's okay. It's part of the normal environment. If you see it earlier, it says, okay, that's part of the normal environment rather than being introduced later and saying, what's this? I'm going to go attack it.
Okay, but how do you do it, though, if parents want to introduce their babies to peanut butter?
Yeah, well, first of all, as you always hear me say, please check with your healthcare provider about this with these recommendations. But the recommendations in general is at 4 to 6 months to introduce a small amount of peanut protein in a baby in an infant safe way.
Okay.
You want to avoid choking, obviously.
Okay, I got you.
And there are some, you know, things you have to think about. Specifically, in kids who have severe eczema, which is a big risk factor for this, they actually benefit really a lot from doing this, but you have to do it in this window. The earlier the better, like 4 to 6 months. And so I spoke to an allergist yesterday, and she was very concerned that people make sure that they know about this. She said, I wish I knew the study was coming. I would have publicized it more. We would have done all sorts of, you know, public relations stuff. But if you do give the peanut protein to somebody like with severe eczema, talk to your healthcare professional, because those kids who benefit the most also may have an increased risk of having a severe allergic reaction. So you want to make sure that you do it in a safe environment with the lowest possible risk.
And what's so important about this is because of that initial bad recommendation, a lot of caregivers, even today, still don't expose their kids.
That's exactly right. And there have been studies about that. You know, it depends. The pediatricians seem to be the best. They know more than other people. But, you know, general doctors and people who are family practices, they don't know well enough. So the idea from today, the big punchline is, this is something that's a changed recommendation. This study shows that it absolutely works. And
any special circumstances, though, that people should be aware of?
I
you hate to take the change and then say, oops, maybe not.
You know what?
Another oops, a double oops.
Right.
Yeah.
It's always the devil's in the details. And yes, there are going to be these things that we're so sure about. Like, look at hormones. Do it, don't do it, do it. Aspirin, do it, don't do it.
Yeah.
But you just have to say, what do we know now?
What does the evidence show?
Look, Bottom line, the peanut butter sandwich is back for lunch, baby.
But really,
yes.
Be careful with the infants. That it's a potential choking hazard, right? Peanut butter is thick. You know, if they say if you give it, water it down, make it a slurry. Talk to your doctor about how to do it. Of course, don't give them peanuts. I really want to emphasize that. There's a choking hazard.
Of course.
Potentially with peanut protein.
For those who don't know, Tony is a peanut butter aficionado.
Yes, he is.
When my kids
have tried them from all over the world, literally.
It's true. We got to go. I got a lot of peanut stories. I'll tell them in the break.
We'll talk about it later. All right, Dr. Jon LaPook, we appreciate you.